At the latest now on the pandemic, Pfizer has petitioned the FDA for a second booster shot for older Americans as there are some signs of a new rise in COVID infections. Eva Pilgrim has the story. Good morning, Eva.
Good morning, George. This morning, Pfizer calling for a fourth shot. The drug maker requesting authorization for an additional shot for those people 65 and older. Now, Pfizer submitting two sets of data from Israel showing the additional shot decreased both the number of confirmed cases and severe illness. The company's CEO saying the fourth shot dramatically improves protection. The FDA will now look at this data to determine if the additional shot is needed and when. The push for this fourth shot coming as some 58 million Americans who are eligible to receive the vaccine still have yet to take their first. This as scientists are closely watching a subvariant of Omicron, BA2. The concern, the WHO roughly estimating it may be 30% more transmissible than the original strain of Omicron and currently makes up for 23% of new cases in the U.S. But while the percentage of BA2 cases are up, the total number of new COVID cases in the country is down. George.
Okay, Eva, thanks very much. Let's bring in our friend Dr. Richard Besser, president of the Robert Wood Johnson Foundation, former acting director of the CDC. Rich, thanks for coming in this morning. Let's start out with your take on this BA2 variant.
Yeah, you know, George, I would pay attention. I'm less concerned than when Omicron first came, because we should see protection from people who've had the current Omicron infection. But if you look over at Europe, what you see is that as public health measures were lifted and this strain was spreading, the number of cases has gone up, and in some places there's been pressure on hospitals. So this is the time, if you haven't gotten your booster, to go ahead and do so.
Let's talk about the boosters. We see this petition from Pfizer. Are we heading towards a world where we're really going to have a booster every year?
Yeah, we may, and I think that's a separate question than whether we want to get a booster every 4 months, every 5 months. You know, it's not clear from boosters how long the protection lasts, and it's not clear whether you start to see a declining return on those boosters. I think the biggest effort here in the country has to be to get people vaccinated who haven't been vaccinated yet, and in rural communities we see some of the lowest rates of vaccination, and to ensure that people who are at the greatest risk are getting their first boosters, because that will provide some protection.
You mentioned Europe seeing an uptick after public health measures are lifted. Are we lifting the mandates too soon?
I don't think we're lifting them too soon, but I think that if people are taking that as a sign that the pandemic is over, they are going to be sorely disappointed. This pandemic continues, and it's critical we pay attention to public health guidance, because if cases go up in communities and there's pressure on hospitals, some of those measures will need to go back in place, and we have to be ready to do that. That's the way this is going to work until the pandemic finally does go away.
Rich Besser, thanks very much. Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.